that relationship is gold. Gold. It's just gold.
Yeah.
That's
And
called collaborative care, chronic care,
that's how we
practice
used to do it.
transformation, the practice of the future, the way it should be.
That's how we used
And
to do it.
it's we should get paid more for doing that
Exactly,
Uh,
because
because
it
that's
has
my
value.
argument. Do you know
It
what?
has
When I,
value.
when I do insurance negotiations, all this stuff that we're talking about,
Yeah.
that's what I bring up. And it says RBK should be paid more than Doc in the Box down the street.
Dr. Hackle says that we are in a state of crisis. The barn is burning in pediatrics. I think we're in an inflection point. And I'm not good with language, but what's the difference, right? I think that the US-based pediatrician for far too long has advocated the responsibility of acting like a specialist in managing chronic care disease. They focused on there were so many ear infections, pneumonias, bronchiolitis, impetigo, cellulitis that you could fill your appointment book, see 40 patients, and never treat ADD, never treat asthma, never treat obesity, never treat this because your schedule was booked.
Correct. That's the way it
Um,
used to be.
I think we're better than that. So I'd say it's an inflection point because I think we have to now pivot to the three legs of this stool. We have to do a well child exam, which I'm in the minority with my fellow pediatricians. To me, the well child exam is a free opportunity to find disease and address it early. All the other educational components can be done through video or a handout. I'm looking for the BMI change, the blood pressure is elevated, the kid's not doing well in school. What is it that I need to intervene early to change the trajectory of that disease? Two, we have to do acute care. We have to have enough bandwidth where we still can take somebody that's 103 fever out of nowhere, take a look and make sure they're okay.
Yeah,
And
and not just do a panel that tests for everything in
correct.
their nose and then stick them on clindamycin.
And then number three, we have to take care of our kids with anxiety, autism, ADHD, type 1 diabetes, type 2 diabetes, obesity, asthma. These are pediatric illnesses. We are the special. Dr. Hackle has a different perspective. He says we're at the end of the road. The payment has gotten so low that we can't attract enough people to match because they can't afford it. Pediatrics is 70% female,
Yeah.
and the women are burning out at 7 to 10 years after they leave residency, and they want out. But 30% of US physicians overall want to retire within the next 2 years. So he says it's not just a pivot, it's not just an inflection point. We're at a state of crisis. Out of the, I think it's $4.5 trillion we spend in healthcare, we only spend 4 cents on the dollar on primary care.
Correct.
Yet
Yep.
we see 50% of the patients,
Mhm,
and we're asked to do more.
mhm.
And how? When you're seeing 30 patients a day, you're not providing quality. You're sticking your finger in the small holes in the dike and hoping that no one gets harmed by it.
Mhm.
So
100% true.
in my what I call my call to action is
Mhm.
pediatricians may need to make the same as any other physician, which is 350 a year. It's a lot of money,
Mhm.
undeniable. But these
Mhm.
kids are coming out with $300,000 in student debt,
Mhm.
and they missed out 10 years of getting opportunity.
Correct.
And there has to be a
And they
limit.
worked really hard to get there too,
Yes,
Right.
and
right?
and I know I'm being ungrateful, and I don't like being ungrateful. I have such a blessed, lucky life. It's like a rock star life.
Yeah.
Okay. And it only gets better. I don't know why. I'm just lucky,
Pediatricians are the rock stars of medicine.
but I'm
They
lucky
invented preventive care.
Yes.
Yeah.
to become a pediatrician, a family practice doctor, an endocrinologist, orthopedic surgeon, whatever it is. You give up the best 10 years of your life
Yep.
between 20 and 30. There is nothing can buy you that back.
And for women who want to have children, many of them then delay it until it's difficult for them to have children.
True.
Either
That is
are
true.
not able
You-
to have their own family or struggle to have a family.
But
Yeah,
the reality is that woman gives up her best reproductive years and opportunity to find a mate. And so she's 30, out of residency, needs to start working, is huge debt, and now has to find a life partner and build a family as she's building a business. This is a tremendous burden on a human being. I
That is
couldn't do it.
correct.
I couldn't do it.
That's correct. But building a
And so,
business is just like any other business. Ice cream store, card shop, video store, it's all working hard.
no, because you don't have to go through 11 years of education
you
to
don't start making
Yeah.
your ice cream shop at 30.